My name is Cameron Brown, and we have a pretty busy schedule today. First, we're going to hear from Kirk Ford, who's the manager of the Department Operations Center. Next, we'll hear from Ann Molgard, who's the director of Public Health Department. And then finally, we'll hear the COVID update from our acting health officer, Dr. Doohan. So let's jump right in. I'm going to hand it over to Kirk.
Thank you. Good afternoon. I'm going to do a screen share here. We're going to look at some slides, similar to what we looked at last time. All right. That looks good. Okay. So we're going to start by looking at our testing rate. And this is our testing information based on collected at the state level. And so we are the dark line and the state is the light gray line. And we can see that the testing rate per 100,000 per day, and as well as testing positivity. This is a 7-day average. And you can see kind of on the rate, our positivity rate has increased recently, and the state is slowly starting to increase as well. It looks like we're starting to come up with more of a peak than we saw previously. And then this is a breakdown what we had last time, showing our case rate per 100,000 in comparison to our similar counties, Lake County, Mendocino County, and Sonoma County as well. You'll notice that big orange spike is Lake County, which is seeing a large amount of cases recently. Mendocino County is the green line, and Sonoma County is the red line. The blue line that's a lot smoother is the California average, or California case rate per 100,000. And so you can see that the case rate in the state is increasing as well. So everything is on the rise. And this is just a reminder of our stats tracker for Mendocino County. This is on our website. We talked about early at mendocinocounty.org/COVID-19. There's no dash between the COVID or 19. It's just COVID-19. And it's under case data. And as you can see, we've got 9 in the hospital and 5 in the ICU today. And this is looking at our hospitalization data. This is also reported at the state level, showing our 14-day average for reported date for ICU, as well as med surge, which is just a way of saying those people that are in the hospital, but they're not in intensive care. And then this is a slide looking at the deaths. We had previously talked about deaths last time, and there was some request for some more broken down data. There's a lot kind of going on here, but very similar to the stat tracker. This information is pulled out by geographic location in Mendocino County, North Coast to South Coast. And you can see that the majority of them are in the Ukiah area. As well as the race ethnicity data we now have. And on the right side, deaths by age. I think Mendocino Action News requested that last time, and that there's that data showing that the majority of the cases are 65 and up. There in the middle, we have gender, most are male, and then absolutely all of them are unvaccinated. There are no vaccinated deaths, and these are 50 deaths, what we've had. We haven't had a new one in a while. So this is just a way to report the data that we've had for transparency. Looking at vaccination information, this is the eligible population on the left-hand side. Remember, those that are 12 and older. This is showing that grouping in Mendocino County. About 60% are fully vaccinated, which means they've had both shots or one shot of the Johnson & Johnson. 8% partially vaccinated, which means that they're either halfway through their series of the Moderna or Pfizer, and 32% have not taken any shots. And then the chart on the right is showing that based on our total vaccination population, which is even those that are not eligible for the vaccine, how do we stack up as a county as a whole? And so we're just tipping the scales at about 53% of our total population that is fully vaccinated. So we're obviously trying to push everybody to continue to get vaccinated And we also looked at partially vaccinated that have been greater than 30 days. This is showing that about 6% it's been greater than 30 days. And then there's another breakdown in the slide coming up that also shows a 60-day breakdown, which is very similar. This is that these are some actual numbers instead of percentages, if that makes a little bit more sense, showing the vaccination by population, as well as what we're calling them the under-vaccinated cohort, which is a group of people that we've identified that got their first dose, and then it's been more than 60 days, and they have not gotten their second dose yet. And we're looking at this data a little bit more to try and understand what's happening here. Did these people just choose not to get a second dose? Have they gotten a second dose and we don't have a record of it? So we're going to start trying to track down these folks with some of their contact information to find out what happened, and hopefully either get them a second dose if they need it, or make sure that our data looks good on all sides. Also, we're looking at vaccinations by the brands. We have the majority of Mendocino County residents received the Pfizer vaccine at 22,500, and then Moderna is there in blue, and Johnson & Johnson is the purple color. And then those of the partially vaccinated, because you can't be partially vaccinated with Johnson & Johnson for this graph, you've got Pfizer and Moderna. And then there was a question about those that were fully vaccinated, yet were still infected, still got infected with COVID. So that's called a post-vaccination infection. And this is our current count for Mendocino County. We have 55 post-vaccination infections of people who are fully vaccinated, as well as symptomatic. So they have to have symptoms for them to be counted on this chart. 33 of those are in Pfizer, 12 Moderna, and 10 of the Johnson & Johnson. And then on those who are partially vaccinated, we have 43 of those, 19 Moderna and 24 Pfizer. And those are folks that somehow got infected between their first and second dose of the vaccine. So using these numbers and the numbers that we looked at in the slide ahead, we can look at the rate that we're seeing post-vaccination infections. And then this is a breakdown of age for those who are post-vaccination infected. So you can see that it's 19 and up, because those 12 and older those 12 and younger, sorry, are not eligible for the vaccine, as well as our ethnicity breakdown and our gender breakdown for the post-vaccination infections. And this is the current rate of each of the vaccines currently from Mendocino County. You'll notice those numbers are very, very small because that's what we're seeing here in Mendocino County. They're much larger when you start looking at bigger numbers statewide as well as nationally, right? We're seeing national numbers, that post-vaccination infection rate closer to 5 or 10%. But we haven't even reached 0.5% here in Mendocino County. So it's extraordinarily rare to get COVID if you're fully vaccinated. But we are seeing an increase in cases because we're seeing more people that are vaccinated, and as the cases continue to spread, we are seeing some of those post-vaccination infection cases. That chart is noted on the right. This is the number of cases that we're seeing by month that are post-vaccination infection cases. And this data comes from the state that is kind of looking at that as well, looking at that post-vaccination infection rate versus people who are unvaccinated. So what's really important here is the fourth bullet down. This is from the website, which I've placed the link there at the bottom. You can't click on, unfortunately, during the presentation, but you can take a screenshot of it or snag it on your cell phone. But that's the website that I got this data from. And I'm most interested in that fourth data point for the week of July 7th through the 14th. The average case rate among unvaccinated Californians is 13 per 100,000. And the average case rate among vaccinated Californians is significantly lower at 2 per 100,000. So if you are fully vaccinated in the state of California, you have a significantly lower risk of getting COVID. And this is just those that are getting it. It's a significant decrease, as well as there's some other factors that we'll talk about a little bit later as far as to your health. We haven't seen any vaccinated deaths. So even those that are getting post-vaccine infections, the detriment to their health is much less diminished. And let's go on to variants. So variants is the big hot topic. These are the current variants. On the graph on the left shows variants of concern that are in the state of California from July 4th through the 17th. These are the number of positives that have gone through whole genome sequencing and revealed which variant they currently have. The alpha is in the blue, the gamma is the green, the delta is the orange, and anything else that's not one of those is the gray as the state's data. So as you can see, the delta is on the rise statewide as well as nationally, just by looking at the news, that delta is pretty much everywhere. We're seeing that as the primary variant of concern that's spreading. And it is much more infectious, about 40% more infectious than our current strain. And on the right, this is our internal data that we have of our own variants, of those that are positive in Mendocino County. You'll notice that we have a little bit more alpha because this is our total values of all time. We're just kind of keeping a track. We only have 21 positives that we've actually been fortunate enough to get whole genome sequencing done. Part of the problem with being a rural county is not having quite the level of access to whole genome sequencing that some of the bigger counties do, especially those in the Bay Area. So our whole genome sequencing information and the number of variants we have tends to lag behind that of the state or those of larger counties. So our data may not show a great picture of what's happening here at this point in time. So that's kind of why we're showing that state of California data, because that's probably a more realistic idea of what's happening with our variants, is that large delta coming through. And that's it for there. And then I think I'm going to hand it to Anne. Anne's going to talk about masking.
Anne? Okay, great. So Ann Mulgard with Public Health. And the short story about masking is that we follow the CDC and CDPH guidelines. They have the weight of law. What they are currently saying is that unvaccinated people need to mask indoors. Our local Mendocino public health officers, who understand what our local situation is way better than the CDC or CDPH does, is actually recommending that everyone mask indoors. And there's a number of reasons why. You don't want to get it. You don't want to get the long-term effects of COVID. You don't want to accidentally transmit it to others. Every time the infection gets into a new person, it's another chance to mutate. It could just keep going and going and going. So that's why our current recommendation from our public health officers is for everyone to mask indoors. But we do understand that the weight of law is saying that just unvaccinated people need to mask indoors. Again, if you look at the bottom, you will see the exact guidance. This is just excerpts. If you want lots of detail, please go to that website. A lot of businesses are having a hard time trying to see, okay, where is our line? What can we do? How much power do we have as individuals? And this is the guidance for them. They actually have a lot of power as an individual business owner. For example, in the last bullet, they can require all patrons to wear masks. That is up to them. But right now, what the California law is saying is that masks are required for unvaccinated individuals. So you can, as someone approaches your business, you can say, here's the rule, and then you just allow them to self-attest whether or not they're vaccinated or not. And then there are different rules for your employees that involve Cal OSHA and other things. and of course, you can't not allow someone into your business if they are wearing a mask. That would be a rather extreme situation. With schools, so, this has changed during this pandemic about who makes the decisions. So just to be clear, right now, the determination of what happens in schools, starting when they go back at the end of August, is CDPH, and they are implementing the CDC in the California context. So those are the rules. It is not the public health officer or the school district themselves. Now, the interesting thing now, though, is who enforces the guidance are the school districts. So that's going to be a big conversation with superintendents and school boards and parents and union leaders and teachers. And we will certainly be available to advise and help them navigate through this. But again, it's not our call this time. The goal of the CDPH very recently released just a few days ago guidance is a safe, successful, and full in-person instruction in the 21-22 school year. And what they based it on is that students must have access to safe and full in-person instruction and to as much instructional time as possible. And what that translates to is we just want kids to miss as few days as possible. And again, there's your link at the bottom if you want the more information. So there's a strong emphasis. In order to get kids back, we have to do every prevention method that we can. And the prevention methods we're doing in order to safely get kids and teachers back into school is vaccination for everybody who's able, because that will lower our rate overall throughout the community, universal masking in schools, which enables us to do no minimum physical distancing in the schools. And what that means is that most of our schools don't have room to be 6 feet apart and still do in-person learning for all of our students. And so through a lot of study, and especially the study of schools around the world that have done different things in different places, CDPH has decided and CDC have decided that if you're doing the vaccination and universal masking and targeted quarantine, then you don't need to do the 6 feet apart. And that's going to allow us to bring our students back into school. So that's, so that's it. That's it for schools.
And I noticed that I skipped my little slide here that was supposed to show our upcoming vaccine clinics. Now that we talked about vaccines so much, here's some upcoming vaccine clinics before we hand it to Dr. Doohan to talk about the new Delta variant and the role of CICT.
And those vaccine clinics can all be found on the COVID-19 website of the county.
Absolutely.
Okay. Is that handing it over to me?
Yeah. Okay. Which slide would you like for the Delta variant? We don't have anything that's...
I think I can just speak to it. Thanks
Okay.
for setting it up, Kirk, with your great slides, and for Anne. I want to clarify for all of you that Dr. Coren is still our health officer, and I am still our deputy health officer for Mendocino County. He has had a personal emergency, and so I'm stepping in for the media day today, but we still do have Dr. Coren as our health officer. So to start off just with some follow-ups, sorry, got some background noise here. Hold on just a minute. Sorry, a little technical difficulty. There we go. Just a couple of clarifying comments that the CDPH and CDC, when they give a guidance, that is the same as an order. And it is can be legally enforced by the state government. When Anne was mentioning earlier that we have, our health officers have a recommendation for masking indoors at this time, that's a recommendation. It's not an order. It's not a guidance. That means we're just giving you our professional opinion as the health officers, just like we would if there was any health issue in our community that we wanted to provide information to the public and our recommendations. So at this time, the reason that we're recommending that everybody, regardless of vaccination status, mask in public places indoors, is that what we're seeing, as Kirk presented, is that we're surging again pretty seriously. And we are using the old terminology now in the purple tier. And we do have a large number of people in our hospitals, including in our ICUs. It's getting, if it keeps going this way, it's going to be, could even approach what we saw last winter. And ultimately, our goal with this pandemic is to protect the hospital systems and our healthcare delivery systems so that they're not overwhelmed, and to slow the spread and what we call flatten the curve, so it gives us more time to prepare and respond. So what we don't want is an outbreak of cases so strong that the hospital can't handle the number of cases. So our job is to slow things down. And so when we, in terms of the spread, when we say what we're recommending for Mendocino County at this time, and keep in mind, I said recommending, I did not say ordering. What we're recommending for Mendocino County at this time is when you're inside in a public place, you wear a mask. The reason for this, to follow up on what Anne presented, is that the CDPH guidance says only unvaccinated people should wear a mask inside, but we can't tell who's vaccinated and who's not vaccinated. So by saying that everybody should wear a mask inside in a public place, that's just making it easier for us to know that everybody's staying safe. Another point I want to make is that as we go through this pandemic, the focus of our DOC, who's presenting today, our Departmental Operations Center, and our COVID response has changed. So in the beginning of the pandemic, it was the Public Health Department that did all of the testing. And it was the Public Health Department that did the vaccinations as well, the vast majority of the vaccinations for our population. As we move forward into the pandemic, the testing and vaccination is shifting to the healthcare delivery system, the hospitals, the clinics, the pharmacies. And the focus of our public health COVID response is on case investigation contact tracing, which we call CICT. So making sure that every single case, we look at that case, we evaluate that case, we look at who their contacts were, and we make sure that we contain outbreaks so that we slow the spread and flatten the curve. The county is still doing vaccination and testing, but at a much lower level than we did initially, because our excellent partners in this county, who I mentioned earlier, the hospitals, the clinics, the pharmacies, are taking over with vaccination, as well as we have a much less demand for vaccination at this time. We wish we had a greater demand, and if we ever do have an increase in demand, certainly the Public Health Department can scale up and participate more with mass vax events. But at this time, if we were to hold a mass vax event, unfortunately, very few people would come. That's what we've observed, even though only about 50% of our population are fully vaccinated. So the other thing that we do with great intensity in our DOC is we track data. We analyze data. We make sure that we're aware of the data coming from the federal government and the state government, but also our own data. And we learned early in this pandemic that if we didn't track our own data, we might have gaps in that data because it won't necessarily be tracked by the state all the time. So we track our data, every single case. We look at it, we analyze, and we make sure that we're containing outbreaks. And we have done a very, very good job in Mendocino County in containing outbreaks. We have not had any massive outbreaks that we're aware of. They've generally been kept under, I'm just going to, by recall, say about the number 20 of cases related to one particular event, and usually much less than that, under 10. That's very, very good for a small rural county. So with that, I want to move on and speak about the Delta variant. It's definitely in the news and in all of our concerns. What we're seeing right now in Mendocino County is certainly due to the Delta variant. However, what you saw from the earlier data is that the state is not able to provide whole genome sequencing of substantial numbers of these viruses. So we don't know exactly how many Delta variant cases there are in our county. And so those numbers that Kirk reported are certainly undercounting. But we do know that we've at least had 5 of the Delta variant. It's certainly much more. But by the behavior that we're seeing, because we're tracking our data so closely, we're convinced that the Delta variant is absolutely present in our community. The state numbers that are reported is that 83% of the analyzed samples from California in July have been Delta variant. So I'll repeat that, 83% of the analyzed samples from California in July have been Delta variant. And we're going to assume that 83% of our cases in Mendocino County are Delta variant. The reason that this is very significant is the Delta variant is more infectious. So it's easier to spread from one person to another. But another thing that's been emerging that the state has been reporting is that the incubation time is shorter. So that means from the time that you're infected to the time you become symptomatic and infectious is looking like it might be 2 days. Whereas our the COVID virus that we're used to from all these months and months, it was more like the incubation period was 5 to 7 days. So we're seeing a faster turnaround with a more infectious virus. And it's also hitting us at the same time that the state released a lot of the restrictions and people went back to more of normal life. And so there were more opportunities for this virus to spread. Among vaccinated people with symptomatic COVID disease, we don't have the data of how many of those people might have been with the Delta variant or not. We just don't have that information. But what we do know is that partially vaccinated people are more susceptible to the Delta variant. And so for those of you who are partially vaccinated, this would be a very good time to get vaccinated. And we shared information about where you can get vaccinated in Mendocino County. The vaccine is available and it's free. Regarding the CICT, the Case Investigation Contact Tracing Team, these are our heroes, our local heroes. They have been working tirelessly for months and months and months for us in the DOC in the COVID response. They are comprised of county employees, as well as volunteers, and as well as state staff who've been supplied to us. I would ask you, Mendocino County, that if you're called by one of our CICT team, please answer the call, please answer their questions. These, our team members are here to help. And what we do is every day, our team writes a report for the health officers. We look over every single case and we look for common relationships. That individual, when they speak to our CIC team, might not have been aware of commonalities, but this is, for example, how we were able to figure out with Frontier Days that there were quite a number of people who attended while infectious and quite a number of people who got COVID probably at that event. I mean, the numbers were, I believe, under 10 on both the ones who went when they were infectious and the ones who got COVID likely at that event. But we were able to track that because of the cooperation of the public with our CICT team members. Our state staff are going to be pulled back by the state in about a month from now, I believe it is. And we have opportunities for people to volunteer. So if you are interested in being trained to be a CICT case investigator contact tracer, we do have a way for you to become a volunteer and help us. One of the unfortunate things that we've been seeing lately is that when our CIC team calls people who we know have COVID, they refuse to give them information. They won't tell them where they work, they won't tell them where they were or who they contacted. If we felt very concerned about that, because we felt that that presented a danger to the public, for example, we might have a person who's retired, never leaves their house, they don't work, and they tell us they're not going to give us information, we're going to let that go. You know, I mean, there's no big danger to the public there. But if it's someone who says, well, I work in a busy place, but I'm not going to tell you where, and I had a contact with 20 people, but I'm not going to tell you who, and we're very worried, we do have a mechanism in Mendocino County where we can demand cooperation And then if the person refuses, there can be a fine. And this is the same with any infectious disease. For example, imagine a person with active tuberculosis, and they refuse to cooperate with our public health department. There are mechanisms to demand that somebody does participate. We haven't used that yet, but we do want the public to know that it is ordered in the isolation orders to cooperate with the CIC team by sharing information. If we know someone is employed at a certain place and we call that employer, it would only be because we were worried that the employee might not have told them about their case. We don't identify the employee. We simply say you have had an employee who has COVID who's been working, and these are the dates, and we recommend that you reach out to your staff. So important to talk about our very hardworking and devoted CIC team who's been working throughout this whole pandemic. So one comment about the vaccines, we shared where you can get the vaccines in our county, and that is that FDA approval, FDA, a Federal Drug Administration approval, is expected to be upcoming for our 3 emergency use authorized vaccines, the Pfizer, the Moderna, and the Janssen. And it's possible when they become FDA approved, we don't know, but it's possible there could be a fee related to these vaccines. At this time, they're free. And I want to say that to the people that are aware that they're partially vaccinated and it's time to get that second dose, this would be a really good time for you to get vaccinated with that second dose. If our data is correct and we have about 4,000 people in our county who only got 1 of the Moderna or Pfizer, this would be a great time to get that second dose. So I also want to say that with our OptumServe site, our health officers, myself and Dr. Coren, have given the direction that nobody should be turned away if they show up to that OptumServe site for testing, if they have symptoms or if they don't have an appointment. It doesn't matter. We want them to be tested if they come to the site. So that is our understanding. You know, of course, things may have happened in the past that we would apologize for if someone was turned away. But if somebody does go to that OptumServe site and you are infectious, you need to protect our workers. They're putting themselves on the front lines of COVID, and we need them to be safe. So that would require, you know, wearing a mask and staying safely apart from anyone else and any workers that you would encounter at OptumServe. But we will not turn people away. So I have some messages that I want to give specifically to certain sectors of our population, because as the pandemic has progressed, we know we have divided views in our county. And so I get asked about my general recommendations, and it really depends on where you stand with vaccinations. So if you are a vaccinated person, and that's about 50% of the population of Mendocino County, so you've been fully vaccinated, what I want to say to you is that there is a possibility that you could get symptomatic COVID. It's a low possibility, and Kirk mentioned before that it's about 7 times more likely at this time to get symptomatic COVID if you're unvaccinated than if you're vaccinated, but it's still possible. But what Kirk also mentioned is none of the deaths that we've had in Mendocino County have been vaccinated. And that is the trend that we're seeing across the nation, certainly in California. Fully vaccinated people, it's rare for them to be hospitalized and very rare for them to die. So the vaccine is very protective. It's very effective. And for that reason, we can say that for a fully vaccinated person, COVID becomes for them similar to getting a bad case of the flu. For the fully vaccinated person, if you were to get symptomatic COVID, it's probably going to be like a bad case of the flu. You probably will not die. You probably will not need to be in the hospital. And the vaccine is very protective for you. That's for the fully vaccinated person. However, if a fully vaccinated person were to get COVID, they still have to isolate if they're symptomatic for the 10 days. And as well, we don't know if fully vaccinated people who get COVID, if they will develop chronic COVID or what we call long COVID. So those things are different than the flu. You still have to isolate and you may develop a chronic disease. However, the vaccine is very protective, and we've seen that our death rate has stayed at 50. All of these, all these months, we haven't increased our death rate, and we're seeing that right now there's nobody in the hospital who's vaccinated. For those of you who are partially vaccinated, I would like to say that now is the time, and which I mentioned before, now is the time to get your vaccine. So I would encourage you to do that. For those people that are unvaccinated, we respect you. We respect your rights. There is no requirement by the Public Health Department for anybody to be vaccinated. If you're hesitant to get vaccinated, you've been thinking about it, you're not sure it's the right time, you want some more time to think about it, I would encourage you that this is the right time. We're surging. We're looking like we're back in the purple tier from using our old terminology. Our hospital has more patients in it with COVID than it has for a very long time. Millions of people in the United States have received the COVID-19 vaccines under the most intense safety monitoring in US history. Rarely have we seen cases of anaphylaxis. We worried about that very much in the beginning of the pandemic, but we've learned after all of these millions of vaccines we've given that only about 2 people in a million will have an anaphylactic reaction. And it's very easily treated actually by giving a shot of epinephrine, which is carried in vaccination sites. In terms of deaths from the COVID vaccine is very rare. And in fact, the deaths that have been reported, we're not sure if it's from the COVID vaccine or it might have been a death that would have happened if the person hadn't been vaccinated. But the percentage of death from the COVID vaccine is 0.0018%. So it's 0.0018%. It's a tiny, tiny number. And that is based on the millions of vaccine doses that have been given in the 339 million doses of COVID vaccines that have been given in the United States. Compare that to the 35 million COVID cases in the United States that we've had, 35 million. We've had 626,000 deaths from COVID. That's 1.7%, okay? So I know I'm rattling off numbers, but what I hope you take away from this is that the risk of dying from COVID is 1,000 times more likely than the possible rare risk of dying from the vaccine. So I urge you, if you've been hesitant, you're not sure when, please consider now to be the time to get your vaccine. As well, when I talked about the protections of the vaccination for people, that it becomes like a bad flu, that's when you're vaccinated. If you're unvaccinated, this disease is not like the bad flu. This disease is much more deadly and much more disastrous than the flu. So please keep in mind, my comments about the flu were only for people that are fully vaccinated. If you're a person who doesn't want to get vaccinated, you've decided, I'm not going to do it. It doesn't matter. I don't care how much Dr. Dewan begs me to do it, how much Dr. Coren begs me to do it. I'm not getting vaccinated. And also, that would also apply to people that are too young to be vaccinated. But if you're not going to be vaccinated, I would just ask you at this time, when we're surging, we're in the purple tier, we have a Delta variant, please consider wearing a mask when you're indoors in public places. Please consider avoiding crowded gatherings, whether they're outside or inside. If you're in a tightly packed area, outside, you can still spread COVID. Please stay home if you're sick. And please make sure that if you're sick, you stay away from other people and get tested. And therefore, we would be able to offer you support through our CICT team, our case investigation contact tracing team. If you're a person right now who's sick with COVID, I'd ask you to please consider encouraging your friends and family to be vaccinated. Consider using your personal story of living with a COVID infection to encourage others around you. And for those of you who are suffering right now from a COVID infection, to our people in the hospital, to our people in the ICU, to their friends and families, our prayers are with you for your recovery. And for the frontline workers, and I'm going to say this myself as a hospital worker who's back working on the front lines of COVID. I'm in San Diego County doing that work. We're back out there. We're back seeing it. We're seeing the hard things. Now we're seeing younger people dying in hospitals. For emergency first responders, for our firefighters, our law enforcement, all of our people that have to be on the front line having contact with others, just stay strong. We're all in this together. We will get through this pandemic one day. And we really appreciate all you're doing on the front lines for our county. Thank you.
Thank you, Kirk and Dr. Doohan. So we'll now move into the portion of the update where we hear some questions from the media. And given we have about 20 minutes left, I think the best structure, we'll go through one round, one question per outlet. And we have 5 outlets today. And I think we'll have time for 2 rounds of questions. And we'll see from there. So let's begin with Mendocino Action News.
Hello. There's a lot of information, so I'm trying to see what you guys didn't cover or we can repeat here. One thing I was wondering, the slideshows that Kirk Ford provided and Ann Mulgard went over, is there a way that media could get that, prior to the meeting or at least after?
We can provide a copy of that afterwards. Yeah, absolutely.
Okay, thank you. Okay, so was that my one question?
No.
Okay. I just want to reconfirm something. In the beginning, OptumServe, if you had symptoms, you were recommended not to go there and call your doctor's office. But what I believe Dr. Doohan is saying now, that they are not turning away anybody. And if you have symptoms, you can go to OptumServe now. Is there some recommendation when you show up? Is cloth mask sufficient?
So the recommendation remains, if you're sick, you should call your primary care. You should reach out for health care. And that is really the best resource. OptumServe is not medical personnel. So if you're sick, call your doctor. That is going to be call your nurse practitioner, call your physician's assistant. That is going to be our recommendation. What I'm saying is if somebody comes to OptumServe, we are not going to turn them away. If you come and you're symptomatic, you should wear a mask for sure. You should stay 6 feet apart from other people. You should indicate that you are symptomatic and you want to be tested. We will not turn you away. But please protect our workers at OptumServe from your infection, whatever it might be. And again, the first choice is to reach out to your healthcare provider and get their recommendation.
Thank you.
Thank you, Danila. Let's move on to the Mendocino Voice.
Thank you. Thank you so much for all of this information. It's wonderful. I have a question specifically about children under 12. Since the last COVID-19 update on July 9th, there's been an uptick in positive cases among children under 12 and under, about 10 positive cases if I'm counting correctly. And I was curious, does the Delta variant appear to be any more dangerous than other variants for this demographic? And just, I really appreciate all the information about schools, but I know families are concerned about a new school year and just any guidance on how they should be planning travel and planning for the new year with unvaccinated children.
Yeah, this is it's a great question. Thank you. We don't have any evidence that the Delta virus is more deadly or causes more any particular complications in children. Thankfully, what we've seen with this pandemic is that children tend to do better and to not get serious disease. What you saw from Kirk's slides is that our deaths and serious illness are in elder people. So there isn't a thought that the Delta variant or any of the variants is more deadly or harmful in children. Regarding keeping the kids safe, I just will say that we have learned through this pandemic that the outdoor environment is very protective. And wearing a mask is also very protective. So to the extent that activities with children can be outdoors, can have if they're not going to be distanced, like socially distant, if they can wear a mask, if they're able, these are all very, very protective. You remember in the beginning of the pandemic, we were all washing every surface, and it turns out that's not so important. The virus really doesn't last on surfaces. So that activity, of course, we want to wash our hands, and we don't want to touch our mouth and touch someone else's mouth if we're sick and these things. But in general, being outside, staying 6 feet apart, wearing a mask are those things that continue to be protective for us. And then, so importantly, stay home when you're sick. When we look, like I said, we review every single case in Mendocino County. Not all counties can do that. Either they haven't committed to do it, or they don't have the time, or they're too big, but we do it. And I will tell you that right now, there are a lot of our cases that are working when they're sick. They're going to gatherings when they're sick, symptomatic. So I think, telling people stay home when you're sick, and that's going to help a lot. Did I answer your question?
Thank you.
Okay.
All right, thank you, Dana. Next we have KZYX.
Hi, good afternoon. I noticed that in the slide that Kirk showed us, the post-vaccinated infections were much more prevalent among women. But there's kind of a big divide there. Do you have any ideas about why women are more susceptible in Mendocino County to post-vax infections? And were there any clues that you found through the contact tracing case investigation?
Yeah, so thank you, Alicia. I would say to that when we talk about epidemiology in public health, we say there's a small numbers problem. I'm using air quotes, small numbers problem. I would say that difference is insignificant in those small numbers, and that I'm not seeing data on the large data scale that indicates that there's a difference in the genders. And in terms of behaviors, I don't think we're seeing a difference in behaviors between men and women that are causing women to get more infections than men. But I will say that the breakthrough cases, or we're not calling them breakthrough cases, right? Kirk, we're calling them, get my notes?
Post-vaccination infections.
Post-vaccination infections. I'm sorry, I lost my train of thought. For the post-vaccination infections, we are seeing, that people are getting a high exposure. So they're vaccinated, but they may be with someone who's unvaccinated, and that a person was symptomatic in an enclosed space, like in their household, for example. So I do think that if you're vaccinated, it's that high exposure to a high kind of what we call a viral load that is causing the breakthrough in the vaccine. And so that is another reason why we will say, if you have a gap, let's say you're having 10 people and they're all vaccinated, 100%, everyone's vaccinated, that's a lot safer, of an activity to do, because it's unlikely that you're going to get infected from that group of 100% vaccinated people.
All right, great, thank you.
All right, thank you, Alicia. And we'll move on to Mendo Latino.
Hi, thank you. Good afternoon. So my question is related to the Latino population and vaccination. And I wanted to know if the county has any way to provide measurements by towns or areas, geographic areas, of how many Latinos have gotten the vaccine and how many have not, and how you as the county are planning on using that data to reach into more Latinos to get the vaccine.
Yeah, I'll just start saying thank you, Loretto, for that question. Very important to us, is a priority. We are tracking it. This question about by zip code, our FQHCs in our communities, our community clinics, have been doing a tremendous job of getting the vaccine out to all of the areas, all of the parts of our county. And we have that data. So I'd like to hand that back to Kirk or Anne if you want to follow up on that at all.
We do have that zip code tracker, I guess, map on our website at mendocinocounty.org/COVID-19. And when you look under vaccination and case data, you can see there's a map there. It's kind of orange colored, and it will show you the vaccination rate by that zip code. That doesn't break it down by ethnicity, but if we get an idea of what's there, we can then find out where the need is, because there's obviously there's different zip codes that have more need. And then it also looks at the different quartiles and the representation of those quartiles. So that's kind of the best metric we have on the large scale to focus our efforts and focus our vaccine clinics and our testing clinics and the areas that we can interface with the public.
And the quartiles, do you want to say what the quartiles are, Kirk?
I probably won't do a very good job at it. I'll defer to Anne on that.
They're the healthy. It has to do really with poverty, if you will. I mean, it's the areas of our county. Some areas have more wealth than others, and so there's a focus on making sure the vaccinations are in the areas where there are less resources. And the state does track the ethnicity data. So we can tell you we can break down vaccinations by ethnicity as a whole, and we could get the data at a more granular level by zip code if we pulled it.
That would be very helpful, really, if you do.
Okay.
All right, thank you, Loretto. And then finally, we have the Press Democrat.
Hey there. Hi. So my question is about the Delta variant in your county. You mentioned you've got 5, maybe even more. What's the timeline? Like, when did you first, detect the Delta variant in Mendocino County, and at what was the spread rate? Like, how long did it take to get to 5 cases? And then you mentioned how you believe that that's probably below the likely number that's really out there. What's the main obstacle in, getting that official number? Is it simply because, people are asymptomatic and might not know they have it, and therefore they're not, reporting their illness, or is there just a shortage of, staff to actually go out and get that information?
Yeah, thank you. That's a really helpful question, because it gives us the opportunity to clarify how the whole genome sequencing works.
Mm-hmm.
So it is not done in our county, and here in Mendocino County, we don't have our own public health lab. So in those counties where they do have a public health lab, the whole genome sequencing can be done in that lab in their county. But since we don't have a public health lab within our county, we have to rely on, for example, the Richmond lab, doing the whole genome sequencing. And we can request that. We've been able to request that in the past, but there's been a backlog at the level of the state to doing the whole genome sequencing. So I would have to say to you that we're in the dark about the presence of the Delta virus in our county, except that I believe it was in March that we had our first Delta
April
variant.
20th. Yeah, April 20th was our first.
April 20th.
Yeah.
So that was when we first knew we had one, but I'm sure we had it earlier. And at this time, we in Mendocino County, our healthcare ecosystem, our life is entwined with Sonoma County. So right now, if you look at our case rates and our, they look very similar at this time. And I'm just going to assume that the Delta virus is equivalent in Mendocino to what it is in Sonoma County. I also will comment that we started tracking the surge about 2 months ago. So we were seeing indicators that our numbers were rising, but it was rising, our numbers were rising, and I kept saying, we're having a surge, it's happening, it's coming, but it didn't really take off until about, what do you say, team, about 2 weeks ago? And then something different started happening. So our cases were rising about 2 months ago, but they were staying at about 4 a day, 3 a day, 5 a day. Now we're like 12. And now our hospitals have, doubled the number of cases that we've had. So I would go by the behavior that we're seeing in our case rates and the behavior we're seeing in our hospitals, that I believe, just observing that, it was probably about 3 weeks ago, 4 weeks ago, they became dominant in our county, just based on what we're seeing from the cases and hospitalizations. But we don't have the whole genome sequencing because there hasn't been the capacity to do the sequencing for our county.
Okay.
All right, thank you, Colin. And it's 5 minutes to 3 o'clock, so I just want to check in. Dr. Dewin, are you have a hard cutoff at 3 or?
I do.
Okay. So in that case, let's shift to Facebook and YouTube for any public comments. I do see one on Facebook from Holly. Can you please talk about how the vaccine works to prevent COVID? Does it stop the virus from attaching itself to your cells, or do you actually get the virus and the shot immune system helps fight it?
So you get the shot, and like any vaccine, your body makes an immune response against what was injected into you. So your body responds to that virus or that vaccine, and your body does its work by creating antibodies. This is why we are concerned about immunocompromised people and the elderly, because their immune systems don't make as strong of responses to vaccines.
All right, thank you, Dr. Dewin. And considering we have a few minutes left at 3 o'clock, I think it's best that we wrap up this update, and we will see everyone next week, or in 2 weeks, August 6th, for the next public health update. So thank you all. Have a great weekend.